Doctors, what's the pettiest complaint a patient filed against you? A patient filed a formal complaint because I didn't compliment her new haircut during a cardiac consultation. She was there for chest pain evaluation. I was focused on her EKG showing irregular rhythms, and she was upset I didn't notice she'd gone from brunette to blonde. The complaint went to hospital administration, the medical board, and somehow ended up on 3 different review sites. Dr. Reeves lacks basic observational skills and interpersonal awareness, failed to notice significant changes in patient appearance, calling into question her diagnostic abilities. This was during a consultation where I'd identified an arrhythmia that required immediate intervention. But sure, let's talk about highlights and layers. She'd come in with chest pain, shortness of breath, and dizziness. Classic cardiac symptoms. I did a thorough exam, ordered appropriate tests, found the problem, potentially saved her life. But when she asked, notice anything different? And I said, your heart rate is elevated. That was apparently the wrong answer. She wanted me to notice her transformation. I was noticing her cardiac output. The formal complaint was 3 pages. She documented every interaction where I'd failed to engage on a personal level. Apparently, I also didn't ask about her vacation to Bermuda, visible tan lines, her new designer handbag sitting on the exam table, or her weight loss, which I did note, but medically, wondering if it was intentional or symptom related. Hospital administration actually called me in, had to sit through a meeting about holistic patient care and seeing the whole person. My supervisor, trying not to laugh, read the complaint aloud. Doctor showed more interest in my medical chart than in me as a human being. She had an arrhythmia, I said. She also had blonde hair, he replied, completely deadpan. The patient requested a different doctor, got transferred to Dr. Hoffman, who immediately ordered the same treatment I'd recommended, but he noticed her manicure, so she was happy. 3 months later, she came back. Different complaint, abdominal pain. Somehow ended up in my rotation again. This time, I was ready. New earrings? I asked while palpating her abdomen. Yes, thank you for noticing. Found appendicitis. She needed surgery, but I made sure to compliment her nail polish before sending her to the OR 5-star review. Dr. Reeves has really improved her bedside manner. The surgeon who operated on her didn't mention her accessories at all. She filed a complaint against him too. My favorite part was when she wrote on social media that doctors need to see beyond the symptoms. I wanted to reply that symptoms are literally why people come to doctors, but my supervisor suggested I let it go. Now I have a mental checklist. Medical issue first, then quick scan for obvious changes. Hair, nails, jewelry, new clothing. It adds 30 seconds to each consultation. My patient satisfaction scores went up 15%. Got another complaint last month from a different patient, this time for noticing too much. Apparently commenting, new glasses, made me seem creepily observant and focused on irrelevant details. The glasses were relevant. He couldn't read his medication labels with his old prescription. Can't win. But at least the lady with the blonde hair survived her heart condition, even if she thinks it's because I finally learned to appreciate good highlighting technique. The compliment I wanted to give? Excellent cardiac response to medication. The compliment she wanted? Love what you've done with your bangs. She left me a Google review saying I'd grown as a physician because I noticed her shoes during her follow-up. They were orthopedic. I was checking her ankle swelling. But sure, let's call it growth. Still have the original complaint framed in my office, right next to my medical degree. Sometimes other doctors see it and ask. I tell them it's my reminder that medicine isn't just about healing. Sometimes it's about noticing that someone paid $200 to go from mousy brown to honey blonde while their heart was literally skipping beats. The arrhythmia is managed now. Her hair still looks great. Apparently both were equally important. According to her Yelp review, I'm now a doctor who finally gets it. What's it? Still not sure. But I notice haircuts now, so I must be doing something right.